if somebody has to stand, walk, sit, do any activities, bones are required to be healthy.
कि सिर्फ बूढ़े लोगों को ही अपने नीज का ध्यान रखने की ज़रूरत है.
I have seen a lot of females coming to me that they have severe pain when they are cooking.
And next myth is कि bone health जो होती है वो that is determined by your genetics.
But caffeine leaches out calcium from bone.
कि कोक मत पियो because these carbonated drinks ये आपकी bone health को बहुत ज़्यादा impact करते हैं.
Understand what coke is.
कहते हैं ओल्ड एज में जोड़ों का दर्द आना ही आना है, लेकिन ये जो जोड़ों का दर्द है ना, इसके लिए ओल्ड होने की ज़रूरत नहीं है. यंग लोगों में भी बोन की प्रॉब्लम्स आ जाती हैं. तो अगर आज आप जानना चाहते हैं कि कैसे अपनी हड्डियों को स्ट्रॉन्ग रखें, तो ये एपिसोड सिर्फ आपके लिए है, क्योंकि आज हमारे खास मेहमान हैं ऑर्थोपेडिक सर्जन डॉक्टर विविध मकवाना, जिनसे हम जानेंगे कि कैसे आप अपनी हड्डियों को और मजबूत कर सकते हैं और लेटेस्ट टेक्नोलॉजी क्या है अगर आपको नी रिप्लेसमेंट की ज़रूरत पड़ भी जाती है तो. हाय, माय नेम इज़ वीना सोनी. वेलकम टू येट अनदर एपिसोड ऑफ H2 ज़िंदगी, जहां हम आपको बताते हैं कि कैसे आप एक ज़्यादा हेल्दी, हैप्पी और ऑसम ज़िंदगी जी सकते हैं. तो चलिए शुरू करते हैं आज का सफ़र. So warm welcome, Dr. Makwana. पहले तो thank you so much for your time. I can see you're very very busy, but thank you still taking out this time. तो शुरुआत तो इसी से कि कैसे आप हेल्दी हैं, हैप्पी हैं, क्योंकि स्केड्यूल थोड़ा सा बिजी रहता है, तो अपनी हेल्थ का आप कैसे ध्यान रखते हैं?
As you know, I am an orthopedic surgeon, so we have a lot of physical activities to do even when we are doing surgeries. So I have to take care of my joints, I have to take care of my back because our operating hours are really long. And when you have to operate for long hours, your back is the one which takes the brunt. So I do exercises daily, I go for walks, and I see to it that I try to avoid eating junk food. And my diet is very minimal. So whatever I have to eat, I eat before 6, and in the evening, if at all I feel hungry, I have some salads or soups. That's the only thing that I have.
Okay, great. और अगर एक पैरामीटर होता 1 to 10 का about your health, क्योंकि आप एक्सरसाइज भी रेगुलर कर रहे हैं, you eating also well, so on that parameter 1 to 10 के पैरामीटर में where will you put yourself on health scale?
8 or 9.
Wow, that's really really awesome. So awesome इसलिए भी बोल रही हूँ because our channel is all about health, happiness and awesomeness, और आपके आने से थोड़ा और awesome हो गया है, क्योंकि मैं फर्स्ट टाइम एक मेल का इंटरव्यू ले रही हूँ इस पॉडकास्ट पर. यस, ऑल फीमेल्स अब तक जितने भी डॉक्टर्स आए हैं, जितने भी.
आई एम ऑनर्ड.
थैंक यू सो मच, वी आर आल्सो ऑनर्ड टू हैव यू. अच्छा, अगर हम बात करें जनरल अवेयरनेस की, क्योंकि आप हड्डियों के डॉक्टर हैं, सर्जन हैं, तो अगर एक जनरल अवेयरनेस किसी को रखनी है अबाउट देयर बोन हेल्थ, तो क्या उन्हें पता होना चाहिए?
See, bone is basically the infrastructure of your body. So if somebody has to stand, walk, sit, do any activities, bones are required to be healthy. And if they are not healthy, then even sitting is not possible, even lying down is not possible, even turning on the sides is not possible. So you require to keep bones healthy. And as you know, bone is not just made up of calcium or vitamin D or anything. Bone is made up of proteins, so many minerals, and along with the bones, you have to keep your muscles healthy. So bones and muscles form the machinery of your body, which allows you to move or do any kind of activity. So paying prime importance to bones and muscles, it is said that the more you strain the bones, the stronger they become. The more you strain your muscles, the stronger they become. But when you strain it, you have to take care of it. You have to have proper nutrition. Just nutrition is not helpful, or just exercise is not helpful. Both has to go hand in hand. So I would always say bones and muscles need to be healthy with the help of nutrition and exercises or any kind of physical activity or strain. This is what I always tell my patients. So lots and lots of middle-aged patients who come to me males, females, both. What happens to them is we have been working throughout the day, but we still have body ache. We are not at home. We are not sitting at home, even if they are at home. We do a lot of household work. So when you do this household work, certain kind of muscles in your body are strained. Certain kind of muscles are not strained. Now, household work is like for a female, if she has to cook for 10 people, she has to cook for 10 people. There is no choice that she would cook only for 5 people. Is it possible? No. So the mind makes the body work. That no, it is my duty. I have to do a job, so I have to. Now, at that time, her body requirements of either exercise or nutrition or rest goes for a toss. And when that happens, when it goes for a toss, what actually happens is the body will understand for a few days, for a few weeks, no, it will try to recover, it will try to recover. But suddenly your body sees there is no rest. She is doing work every day. So then the body starts giving rise to giving some signals like pain.
And that's the time maybe when we see the orthopedic. तब मिलना चाहिए हमें डॉक्टर से. Yeah, because we are not resting और maybe proper nutrition नहीं आ रहा है, maybe exercise नहीं आ रही है, maybe household work तो कर रहे हैं हम, लेकिन exercise नहीं कर रहे हैं, right strain नहीं डाल रहे हैं, जिन पे डालना चाहिए.
और जितना rest लेना चाहिए वो भी नहीं ले रहे. Because all your activity, as I told you, the more strain you give to your muscles, the more stronger they become. But when the rest is not adequate or nutrition is not adequate along with your strain, then there is a repetitive injury to the muscle, and if it does not recover, they grow weak. Even they are developing, they grow weak. So the good quality muscle is not developed. So along with the exercises, nutrition, rest or recovery period is also very much required. You see there's athletes, you see there's sportsmen, they are using their body like a machine. They train every day, but equivalently they want their body to recover. So if they do not recover, then you will not be able to put that much amount of intensity, or you will not be able to put that performance what you would put if your muscles are really strong and they are not tired.
Absolutely, I got it. तो recovery भी उतनी important
recovery भी उतनी ही important है. So I always tell my patients, you need to do work according to your body capacity. Everybody has a capacity. So if I am able to run 10 kilometers and suddenly I feel that I should be running 40 kilometers, then my body is definitely going to tell me, oh boss, what are you doing?
Right.
If a person can work 8 hours a day and you ask the person to work for 12 hours a day, so for first 2 days, okay, it's happening. But then the strain starts staying back and body does not recover. And then the situation of body ache, muscle pain, neck pain, knee pain, back pain, all this starts. And then there's a cascade which is triggered because of not taking rest, that this cascade leads to cervical spondylosis or lumbar spondylosis or knee arthritis or something called as sciatica, something called as heel pain.
Right.
So these are certain pinpoint situations where you require to seek the opinion or suggestion of an orthopedic surgeon, where an orthopedic surgeon will actually guide you how you should be taking the things forward.
Right.
So many a times an orthopedic surgeon would say, no, you need to take a bed rest. So that is not wrong, because that amount of bed rest is going to improve your muscle quality, it is going to grow your muscle well and help your muscle and body recover.
Okay, great. So I got it कि आपको डॉक्टर से कब मिलना है, या आपको जब आपके पेन्स शुरू हो जा रहे हैं तभी आपको पता चल जाना चाहिए, ताकि वो सिचुएशन ना आ जाए कि आपको सर्जरी की ज़रूरत आए, क्योंकि सर्जरी से बड़ा लोग डरते हैं ना.
See, surgery is an injury to the body. Who wants to get injured? Nobody would want to get an injury done to their own body. So, but there are certain situations where without surgery, there is no gain. So, but that happens in a severe situation, especially in a situation where patient is suffering from mechanical symptoms of back pain. Now, when I tell a mechanical symptoms, means it's not just swelling. It is something is hitting your spinal cord or the nerves going to your back, legs. It is hitting constantly. So you are not able to do your routine or daily activity, what you should be actually doing. And even if you start doing it, what exactly happens is you require a painkiller. And then the pain becomes severe. First there is only pain, then there comes a situation where you feel pins and needles in your extremities. Further step, you start losing sensation in your feet or toes. Then slowly you start losing your control over your toes or feet, if at all the condition is not being taken care of. So body gives you indication right from pain to a situation where your some body part is not functioning because of the pressure on the spinal cord or the nerve. So in this situation, do you have any other option to just go ahead and take medicines and get all right? No, you might not. So this is a mechanical symptom. The disc, or there is something called as a gel-like structure which is present in between your spine bone. It comes out because of excessive strain, excessive muscle imbalance, because your front muscles are weak, your back muscles are strong. So this can happen, and when that starts sitting, these mechanical symptoms will never ever go. So a surgery is required. Similarly, in cases of knee joint pains, what exactly happens is this has come to you because of age or overuse. And you have not taken care of your muscles or bones well. So this has progressed over a period of time. Now after a certain stage, there is no option for patients other than surgery to get back to the normal routine. So डरते हैं, because even I would not like to get myself operated, but if there are situations where there was just one lady, she was suffering from 10 years. She was told by her cardiologist, no, try to avoid a knee replacement surgery. And she was doing it rightfully, as the cardiologist told, because your heart will not be able to take the strain of a surgery. So she was suffering from last 5 years. Now, after 5 years, she comes to me and tells me, sir, now I am not able to bear anything. I have to get operated. So my question was, why didn't you get yourself operated? So her question is, my cardiologist told me not to get operated because my heart will not take the strain. But then, who will do my work? I cannot be a dependent person.
Right.
I cannot, leave all my duties to somebody who is going to take care of me. I have to be active. And who would not like to stay active?
True. So this came from her heart that कि अभी मुझे ज़रूरत है. I want to
not ज़रूरत है. ज़रूरत तो बहुत पहले से थी. लेकिन अभी सहन नहीं होता. अभी मेरे को not the pain, just sitting around and doing nothing.
So it was so difficult कि आपकी basic daily life इतनी impact.
If somebody takes away your freedom, okay, you are lying in the bed. Somebody takes away your freedom and tells you, no, you will lie in the bed, we will provide you with everything. But for how many days would you lie in the bed? For how many days would you would not go out? So I have started getting patients who are 70 years old, 75 years old, telling me, no, I am tired now of the knee pain, as well as restricting myself from doing activities which I wish to do.
Right.
So, जैसे आपने बोला कि you have to stay healthy and happy. So, for staying healthy and happy, you have to do something which you like.
Right.
Which are your hobbies. If your hobbies are not fulfilled, because after a certain age you retire. You have finished all your responsibilities, you have taken care of it, your children, their children, and so many. All the family responsibilities are over. So now there is a want of living life for themselves.
Right. And if your body is not supporting you,
Correct.
then you don't feel like being happy. Great. So अब इतने सालों से knee replacement आप कर रहे हैं,
That's
right?
20 years.
So 20 years, very, very long time. So what are the technological development that you have seen over these 20 years and how safe it has become now?
Correct. So I'll talk with some examples. So when I started my knee replacement surgery, we used to do a normal conventional means a normal knee replacement surgery, how a surgeon would do with the help of his clinical
Eyes.
acumen and eyes and everything. Over a period of time, as the medical field is advancing, you see a lot of developments in certain gadgets. Initially, we used to do surgery with only X-ray. Now, we do a surgery with an image intensifier. So, the X-ray inside the operation theatre would give you a live picture of how you are fixing the bones. So, when you know how you are fixing the bones with the look on the image intensifier, you tend to cut the body less. The skin incisions become smaller. So, these are the advantages. These are path-breaking advances. Now, when these advances we adopt, we require a lot of training to adopt. And similarly, in the field of knee replacement surgery, initially was a normal knee replacement surgery, then came a phase of computerized knee replacement surgery. So, I have been trained for a knee replacement surgery, doing a computer navigated knee replacement surgery back in Hamburg, Germany. And this side of suburb, or I would say this North Mumbai, we had the first navigation machine installed.
Wow.
And this navigation machine I had been using and I'm still using for last 13 years. So it's a pretty long time. What has happened is it has improved my knowledge or my physical accuracy of doing a knee replacement surgery. And since it is giving an advantage to the patient, we have kept the cost so minimum. The patient should not have the hitch. No, I want to do a knee replacement surgery which is computerized, but since I do not have money, I don't wish to.
How much is it for?
Hardly. It would increase the cost by around 25 to 30,000 rupees.
Okay.
That's not much for
Yes.
a computerized knee replacement surgery.
Of course.
Now, since last few years, there has been advancement in the computer technology, and there is something called as artificial intelligence, which is coming into the field of medical technology also. You would have seen so many robotic surgeries happening with the help of some robotic arms and some devices in which the surgeons are sitting outside and operating the robotic arms and doing the surgery. Not many fields have got into, but certain abdomen surgeries, which is the surgeries for hernia, which is the surgery for cholecystectomy, or certain urology surgeries or gynecology surgeries are being done by the robotic arm. Similarly, in orthopedics, there is something which is called as a robotic knee replacement surgery, where the precision work in which there are chances that the human would falter, whether how much ever experience they have. A human has a tendency to human will have a tendency to constantly change certain methods or something, even if they are doing the same thing again and again. If you are walking the same path again and again, unless the path is marked, you will never walk the same steps again and again.
True.
So here, this robot does a job of the surgeon in doing certain steps of the surgery, which is going to make the surgery more replicable, more reproducible, and in the same way as it has been planned prior to the surgery. So this robotic surgery requires immaculate planning. Once the planning is done, this planning is fed to the robot, and the surgeon starts the surgery, and the control of the robot is in the hands of the surgeon, and surgeon is very near to the patient. So many times it so happens patients tell me, "Sir, I am afraid of the robot. I will not go and get operated for a robotic surgery." So I tell them, I am the person who is working the robot, and I will be there right next to you. So routinely robot does not falter, and it will never falter unless until surgeon has goofed up. So the planning is been done prior to the surgery, and we have the result that this is how your knee joint is going to look prior to the surgery. Like if you do something like a 3D animation of an interior design, suppose this place is vacant and you plan to set up this place as a studio or something. This place will have the camera, this place will have the sitting arrangement, this place. So you plan it out and get a 3D generated sequence of how the whole place would look.
Right.
So similarly, we get a 3D generated sequence of how the knee joint would look post knee replacement surgery once it is done with this planning.
Wow. Okay.
So, and we also know the sizes, we also know what implants, we also know how much the bone is cutting, and we try to reduce the amount of bone cuts, because the lesser the bone we cut, the better it is for the patient first. Secondly, it helps the patients to have an immaculate balance, which increases the implant life by 5 to 7 years.
Okay.
Since we know that by doing this kind of cuts, we will damage less of tissues around the knee joint. That gives less pain. And when the balance is good, the pain is less, the physiotherapy becomes a lot more easy. Lesser amount of effort is required to do your physiotherapy. More amount of energy is utilized in strengthening the muscles rather than just gaining the movements. So it is a big advantage, and patients really do not require to worry when we talk of a robotic surgery, because it's a surgeon who is operating, it's not the robot. Robot is just being given the direction for doing certain steps, and that's it.
And so that people don't worry, अब तक आपने कितनी surgeries through this robot you have done, and what is the success ratio like?
See, I have done more than 400 to 500 knee replacement surgeries
With the robot?
Yes.
Wow.
And probably this is a very huge number to be done by a single surgeon in a single center. So I have been doing these knee replacement surgeries since last 20 years. I have done more than 8,000 knee replacement surgeries. But now when it comes to robot, it is the faith of my patients, and it is the blessings of my parents along with my team, who is able to, make me do so many knee surgeries in such a short duration of period. They have been working in day and night. Starting with a robotic surgery, for a surgeon like me, I do a knee replacement surgery in 35 to 40 minutes. So when you do a robotic surgery, there is a complete paradigm shift. There are a lot of things that needs to be taken care of before we do a robotic surgery. So the planning, the sequencing of the events, how a robot would be set up, the positioning of the robot, then many things like, the surgical steps and everything has to be so very immaculately perfect. So we utilize less and less amount of time. So I would say robotic surgery takes in 10 to 15 minutes more.
Okay.
But it is worth the effort, and it's worth the time and money, because it gives you such a good result that patients have really been coming back and telling me, sir, we are very happy that you have done a robotic surgery. Why I would say that? Because for a patient who has done one surgery which is non-robotic, they have experienced so much pain that once we do a robotic surgery, they feel that it was a cakewalk. The patients who are not motivated to do a surgery because of the pain that they experienced in the first knee joint, once they do the second knee joint, they tell many patients, go ahead with robotic surgery. So it's the patients who, give me a good feedback, and they are the ones who refer a lot of patients to me because of the results that they are getting. So it's a very, happy feeling for me that I am at least able to make a lot of difference in their lives, and patients come back to me with good and positive feedbacks and everything.
So where do you see the future of robotic surgeries? And also, क्योंकि कहा जाता है कि robots क्या humans को take over करने वाले हैं, और क्या इससे आपको नहीं लगता आपकी job पर ही खतरा है? ठीक है, today you are operating it, but what if they are AI,
active,
right? They are AI.
So see, as I rightly told you, robots can never replace a human. How much ever emotional feeding we give to the robot, they can never become human. See, we see in many movies that they have started developing a brain, they have started behaving like humans. But a human would always trust a human.
So you're not scared?
Nobody should be. See, when there was an invention of a computer, do the people who were running the calculators lost jobs? No. When the people started developing something which was, done by machines, but have the people lost jobs because of that? No. People lose jobs because they are in a monotony. There should be no monotony. You should keep on learning new things every now and then, because it's only humans who can learn new things. Robot has to be made to learn by humans. They cannot learn everything by themselves. So You should break the monotony. You should have an idea of doing things in a better and better way. So I would always tell, you cannot cross the sea or you cannot cross a milestone in a day, but you have to make efforts every day, which it makes an improvement of little by little every day. That keeps you happy, that keeps you motivated, and over a period of time you will see that you have achieved a lot more than what you would have been in if you had not attempted it.
Absolutely. What a lovely thought, I would say. कि और ये इंटेलिजेंस बात ना humans ही कर सकते हैं, ये AI नहीं कर सकता, ये robots नहीं कर सकते.
There is one book called as Ikigai.
Yes.
Japanese.
I've read that.
You would have heard it. Now this Ikigai talks about people. It's a Japanese way of living.
Yes.
So Japanese people are one of the inhabitants of Earth who have been living the longest of life.
Yes, there are blue zones in Japan. Yes.
So it's not only about the pollution and everything, but the way they conduct themselves. Why? Because this town of Okinawa has maximum amount of centenarians, more than 100 years. There are around 30 to 40 people still living and working after age of 100. So it's not just meditation or food or everything. It's the way they conduct their life. So they keep on working. It is not required for you to work for money. It is required for you to work to keep yourself alive. It is required for you to work to get that kind of appreciation. What you do for yourself first, others might or might not appreciate. You care a damn, but at least you should appreciate yourself. So this feeling of getting yourself appreciated only comes when you make improvements in your life slowly and slowly and slowly.
Yes.
And that has to be taught to many of our children as well as people who are aging gracefully, that you need to keep on working. You need to look at your lives. You need to, you have lived your life for your family, for your company, for so many people. But now when you need to look at your life, you need to give something for yourself to celebrate your life.
Absolutely. वही आपको purpose देता है एक life का, and that's
Correct.
what is required when you want to live a longer and a happy life.
Absolutely.
So is this something that gives you happiness, that you're doing completely?
Yes. Because see, I work from 7 o'clock in the morning till 12 o'clock in the night.
And you feel energetic.
And even at the end of the day, I don't feel that I'm tired. It's only when I hit the bed, I am fast asleep in next 2 minutes. So I always feel that I'm lucky enough that I have been given this opportunity and this art of doing knee replacement surgery by the grace of God, by blessings of my parents and by all my well-wishers, that it keeps me happy and going.
So you are living an ikigai life, I can say that?
Yeah, to a certain extent, yes.
So what is the cost difference between अगर किसी को एक normal knee surgery करवानी है, knee replacement surgery करवानी है, और किसी को robotic knee replacement करवाना है?
See, I in my hospital understand that healthcare or even premium healthcare should be affordable. So this affordability is of prime concern when I think of doing a premium job as well. So I always say that this knee replacement surgery from a normal to a robotic is just a transition of 50 to 60,000 rupees per knee joint, which is, way too less as compared to the advantages that you are getting. And this 50 to 60,000 rupees over a period of time, you will feel that you have spent it for a worthy procedure, which is going to make your life or make the life of the knee joint work for 5 to 6 years more, which is a pretty long time.
Right. और कितना टाइम तक चलती है ये सर्जरी? मतलब do you have to go through the surgery again? अगर आपने एक बार सर्जरी करवा ली है, कितने साल तक it will last?
See, I always tell my patients when they ask me, what is the life of the knee that you are putting? So the knee joint does not wear off, first. Second, I am implanting the knee on the bones. So it is like, if you are putting a wall tile for a wall, what is the life of the tile? You never ask. Because Till the time wall is there, the tile is there. So once the wall is not there, the tile will be of no use.
Okay. So it's once in lifetime thing.
First. So you need to take care of your bones. If your bones grow weak, then whatever joint I put inside will not hold, because I am fitting the joint on your bones. So you need to keep your bone and joints really healthy by following certain instructions, which I usually tell my patients is, these knee joints I am putting in for your life. Do not damage your bones. Take proper care of your bones by eating regular calciums, vitamin D, and certain bone growing or anti-resorption medicines which I prescribe regularly. So your joint would last you for life. My regular follow-ups are start from 3 months, 6 months, a year, and year on year, once in a year.
Okay, that's it.
So I prescribe them that you need to take these medicines in this year. You keep on taking that, and keep on doing certain basic exercises like walking or certain strengthening muscle strengthening exercises, and that should be it.
As you said कि जितना strain करेंगे उतना strong होगा. ऐसा नहीं है
Yes,
कि
so
strain
your
करेंगे
bones will
तो
become strong.
problem
क्या होता है जब भी एक बार नी रिप्लेसमेंट सर्जरी करा लेते हैं तो बस अभी तो हो गया ना, अभी क्या है. So when they ask me how many days do I have to do exercises, I always tell them, you are going to do the exercises that many number of times as many number of times you are going to eat. So the day you are fasting, you don't do exercises.
Awesome. So simple to remember. आप खाना खा रहे हो, exercise करनी है उस दिन.
Because you eat. Why do you eat daily? You have eaten yesterday. Why do you want to eat today? Because your body requires.
Now this will be a little quick and fast. I will be asking you a few questions. तो अगर वो true है तो ठीक है, we'll just let it go. And if it's false, then why is it false?
Correct.
That I would want to know
Sure.
from you. These are some of the myths that we have heard about bone health, and we are starting with कि सिर्फ बूढ़े लोगों को ही अपने knees का ध्यान रखने की जरूरत है.
False.
And
This is not a truth. Because बूढ़े लोगों को तो ध्यान रखने की जरूरत ही नहीं पड़ती है, क्योंकि उनके घुटने इतने घिस चुके होते हैं. They have already damaged the knee joints, and if at all they have not, they should. But the training starts right from your younger age. How to sit, how to stand, what things to avoid, and if you have certain hobbies which is going to damage your knee joints, then work around the muscles of your knee joint and know your potential. Not everybody can run 20 kilometers marathon in 6 months or a year, till the time that they have developed their muscles and strengthened their muscles to a level where they would be able to run the marathon without any injury, without damaging the knee joint, and if required, they will be able to run the marathon for another month also, and another month also, and another month also.
okay, so धीरे धीरे maybe you can increase
The capacity.
Yes,
but it is always like that.
Immediately नहीं.
Right.
Right, great. और ये कैसे खड़े होना है, कैसे बैठना है, maybe अगर थोड़ा सा आप explain कर सकें, because you said that's very important.
Like, I have seen a lot of females coming to me that they have severe pain when they are cooking. So when you stand for longer duration, it's your muscles which are getting strained, and when the muscles are started getting strained, the bones starts feeling the heat. So if you start walking for first kilometer or 2 kilometers, you will be walking with your muscles. And now you have decided you will be walking for 5 hours or 5 kilometers. So the next 3 kilometers, it is the bones which are taking the hit. So similarly, if you are cooking for longer duration, if you feel the pain, sit. Who is telling you to stand for so many hours? You should listen to your body. Right. If you don't listen to your body will not listen to you.
Yeah, and then they will have to listen to you.
Absolutely correct.
Right, okay. Second myth is drinking milk is the only way to get enough calcium in your body.
Yes, it's true, but only for kids.
Okay, तो मतलब जैसे आप बड़े हो जाए आपकी requirement change.
Calcium from the milk does not get absorbed. Milk is a good source of protein, but not only calcium. Some amount of calcium is absorbed, but not all. So, milk absorption requires a lot of vitamin D. Initially, in the babies, a lot of vitamin D comes from mother's milk. So, for first 6 months, yes, milk helps in increasing the calcium content of the bones. But after 6 to 8 months, I would say after 5 years, milk does not have a positive effect only on calcium. So you require to take certain calcium supplements which help in increasing your bone calcium.
Okay.
Plus, bones are never devoid of calcium. Your brain working, your muscle working, your kidney working, liver working, your blood, everything requires calcium. So if body is short of calcium, it will take it away from your bones because bones are calcium stores.
Now the myth number 3 is कि weightlifting और strength training जो होती है वो bone health के लिए बहुत खराब होती है.
No, this false. Weightlift, as I told you in my interview earlier, when we are having a talk, the more you strain the bones and the muscles, the stronger they grow.
Yes.
So if your muscles are not strong, what happens is people who are doing weight training, they are wanting quick results. So when they go to the gym, the first thing that they start doing is lifting the weight. No, your body is not conditioned to lift the weight. Even if you are lifting the weight, you should go slowly as per your body is developing. So body always gives an indication before it starts getting hurt. So your trainer might push you to lift more weight so that you are all the more motivated to lift more weight again and again. So no, it does not work that way. So you have to listen to your body, not to your trainer, whether you are going to lift more weight or not, but you should. And again, I am not against you having trainers, but these trainers should be well qualified enough first, and second, they should know that weightlifting is more important to train your body to become strong, not to injure your body. So unless until you are going to participate in some weightlifting competition, you do not need to lift weight so much that you injure your body.
एक और myth ये भी है कि supplements can replace the healthy diet अगर आपको bone health maintain करनी है.
No. See, supplements can help. They are actually not supplements, they are complements. Complement means they should be added to your daily routine so that a human would not always get all the nutrients what their body requires by the simple diet that they take, whether they are vegetarian or non-vegetarian. So they would have some deficiency in their diet which their body might require, and so they are supposed to use certain nutritional products like vitamins, like proteins, like calcium. So these are things which taken along with your daily diet keeps you healthy and happy.
Okay. And next myth is कि bone health जो होती है वो that is determined by your genetics. कोई कहते हैं मेरे तो genes में ही है इसलिए मुझे होगा ही होगा ऐसा.
Yeah, the thought process is definitely genetics.
And what if you change your thought process?
So then you will not feel it is genetics.
So it starts from here?
Yes, absolutely. So some people, my mother has arthritis, so I will have arthritis. But I tell them, you have not shown any symptoms of arthritis from your childhood till right now. So then why would you have arthritis, even if your mother has it?
Right.
So that's been ingrained into your thoughts that this is going to happen. And many a times you want to blame somebody for obesity. No, I am obese because I have family genetics. So then they would not blame the diet that they take. They would not blame the inactivity that they do. They would not blame the habits which will make them more obese.
Right.
They would blame thyroid. They would blame genetics. They would blame, no, it's because of the supplements that I'm taking. I put on gaining weight. So, no.
Okay, so it's all here. Great. Okay, एक और myth है कि bone health जो होती है वो women की ज़्यादा खराब हो सकती है as compared to men.
See, what happens is women undergo a lot of hormonal changes in their body.
True.
Right from the time they achieve menarche, they have a reproductive cycle, and then they have menopause.
Right.
These hormones going up and down has a lot of effects on their body, especially bones, muscles, and fat. Because every time a hormonal changes happen, it disturbs their metabolism. And they have to good hormones, progesterone and estrogen. Estrogen is for gaining weight, and progesterone and certain other hormones help in controlling the estrogen to a level where the weight gain is not much. So post menopause, there are certain situations where estrogen level goes up and there is a lot of fat deposition. There is a lot of water retention. So all this causes some amount of strain on the body, which otherwise would have been healthy. So my knowledge about hormones is not really that great, but I would say that females are more governed by their estrogens. So their body mass or muscle to body weight is lesser than of men who are more governed by testosterone.
Okay, so that's why maybe women के bone health पे ज़्यादा impact
Yes, because muscles and bones are more stronger in a person who has more of testosterone. So that's the whole idea, and that is why females have slightly weaker bones, but they are more emotionally stable. They are more emotionally fulfilled. They are more emotionally stronger than males.
Okay, so this is just the physical difference.
Right.
Yes. एक और चीज़ मेरी मम्मी भी मुझे कहती थी ये चीज़ तो कि कोक मत पियो because these carbonated drinks ये आपकी bone health को बहुत ज़्यादा impact करते हैं.
Understand what Coke is. Coke is something like, I do not know whether you have seen some soda makers which are available. So these soda makers, what you attach a carbon dioxide capsule, you force the carbon dioxide inside water and becomes soda. So why do you want to take in carbon dioxide first? Second, Coke has a lot of sugar and it has caffeine. So people want that kick of caffeine. So they are more addicted towards Coke. And this caffeine, if taken in excess, leaches out calcium from your bones. So it's not the soda which is harmful. Yeah, soda causes gastritis or hyperacidity kind of a situation because it is acidic in nature. So that is one of the things that you need to avoid. But caffeine leaches out calcium from bone. Okay. So even more coffee is not good. So it gives you a kick.
Right. That's why most of the people take it. It gives you that kick. दोपहर में especially जब नींद आ रही होती है.
Yes.
So maybe 1 cup is fine, but not beyond that.
So I am not against coffee again. Coffee can be had in many ways. So there are some decaffeinated drinks which are coffee again.
Right.
So avoid the caffeine part and have coffee.
Absolutely, great idea. That's. अच्छा, और कौन सी चीज़ें हो सकती हैं जो कि हम पूरी तरह से avoid कर सकते हैं if you really want good bone health?
आपको avoid नहीं करना है, आपको regular लेना है. So you have to do exercises. You have to have proper sleep. You have to have bone and calcium supplements. And you have to have a proper exercise schedule every day.
Okay, awesome. So these are some of the things जो हमें करनी है. बेशक कुछ avoid करें ना करें, लेकिन at least balance में अगर हम ले रहे हैं तो which is fine. अगर हम junk food भी खा रहे हैं तो अगर थोड़ा बहुत खाते हैं तो
some days it's not like you have to kill your desires. But you should not go overboard with your desires.
True, that's balancing your life, and that balancing will bring in a lot of health and happiness in your life. Okay, just share some of your success stories. Maybe one of the biggest success story of your life जो आपको हमेशा याद रहती है कि हाँ, this is something यार, which I feel wow, what did I do?
It's not a really happy story. It's a sad story, but the patient was happy. A patient was suffering from something which is called as a neurological disease, where his joint loses out on sensation. So suppose your knee joints loses out on sensation. So you walk, you dance, you do everything, but the injury that is caused by those activities, you don't come to know because you don't have pain.
Okay, that means you're getting injured, मतलब आपको नुकसान पहुंच रहा है, but you're not understanding that.
Because you are not aware of it. You do not have
Okay.
pain. So pain is a big protective mechanism
Right.
of your body, which tells you that something wrong is happening.
Okay, yes.
But that patient did not have. He was 30 years old.
Okay.
So when he came to me, he had damaged both his knee joints. And we did a knee replacement surgery for him. Then what happened was he became all right. He started walking and doing things. But that knee replacement surgery also gave up.
Okay.
And he was suffering from infection in the knee joint because of some other reason. Because his other joints also were not having sensation. So any injury to his leg, he would not come to know. Any pus forming there, he would not come to know. So what we decided with common consent was to remove the part of his leg which was getting infected.
Okay.
And once we removed that, and he was suffering from that since 7 to 8 years. He would have undergone more than 40 surgeries to cure the infection, to heal the bones, to do things. So he was like, on the verge of committing a suicide. He had 2 small kids. He was not able to work. His wife was taking care of him. His relatives were helping him stay alive. So I gave him an option. Suppose if I make you stand in 2 months' time, would you be ready? So he told me, yes, I would be very happy. So I told him, I would want to cut off your leg at a level. The moment I cut off your leg, you will feel that I have taken away some part of your body, but wait for 1.5 months. Then we gave him artificial limb prosthesis and a good make. He was walking on 10th week from the day of the surgery, and he was so happy. He used to travel by train, he used to go to his work, he used to go to his village, he used to enjoy time with his family. So he was so happy that wherever he used to go, he used to send me a video of the activity that he used to do. And he told me that I have changed his life. Wow. So not a very happy feeling of cutting off somebody's legs, but I made him independent again. That was the need of the hour.
Yeah, so this is a perspective, अगर आप देखो तो हाँ, one perspective says अरे आपने तो legs काट दी, ये कैसे सही हो गया, and the another perspective is yes, at least he's independent, and the
because
minute
nowadays
he must be...
the medical science has progressed so much that a person who is having artificial legs can run faster than a person who is having his own legs.
So yeah, see, कितना अजीब है वैसे कि हाँ आपके legs नहीं है लेकिन फिर भी आप फ्री फील कर रहे हो, आप लाइफ एंजॉय कर रहे हो और आप हैप्पी फील कर रहे हो. एंड आई एम श्योर जब आपको वीडियोस भेजता होगा तो देन यू मस्ट बी फीलिंग हैप्पी.
एक्चुअली आई फील सो वेरी कंटेंटेड दैट आई हैव मेड अ लॉट ऑफ डिफरेंस इन माय पेशेंट्स लाइफ एंड आई फील वेरी satisfied with the kind of job that I did. Though the job which I did was not a very great thing and was a very simple thing, but taking a call of doing that and standing by it was very important for me at that moment, because if I had not done that, he would have been still roaming around, emptying pockets against doing some surgeries which were of no value.
And not feeling the pain, not understanding what's happening to him. So taking the right decision made his life change completely.
A lot more.
Amazing. That's a great story, I would say. And on that note, I would say thank you so much.
Pleasure.
Is there any last word that you would like to say to people who are listening to you? Yes, something very great that I learned is that everything starts here.
Absolutely.
Yeah, everything. चाहे आपकी bone health ही क्यों नहीं है, it's starting here. This is something really, really awesome that I learned from this discussion. Anything that you would like to say to our audience at the end?
As the life advances, there will be many ups and downs coming in your life. Don't make anybody responsible for it. You yourself are responsible. Take the decision in your hand and live your life to the fullest. Nothing can hinder you from having a happy and independent life. It is you and you who would make a difference in your life, and you are the key to your happiness and success.
Awesome. Thank you so much, and we leave everybody with this note. Thank you, Dr. Makwana, for spending this time with us.
Pleasure. It was really nice having you here.
उम्मीद करते हैं आज के एपिसोड से आपने काफ़ी कुछ सीखा होगा और इसे जल्दी से दूसरों के साथ भी शेयर कर दीजिए, क्योंकि ये कई लोगों के काम आ सकता है। और हाँ, हमारा चैनल सब्सक्राइब करना बिल्कुल मत भूलिए, क्योंकि जब आप सब्सक्राइब करते हैं ना, तो हमें भी मोटिवेशन मिलता है कि हम आपकी लाइफ में कुछ वैल्यू ऐड कर रहे हैं। और कोशिश तो हमारी यही रहती है कि जितने भी एक्सपर्ट्स हमारे पॉडकास्ट पर आए, वो कुछ ना कुछ आपको ऐसा सिखा कर जाएं जिससे आपको लगे कि हाँ, आपने कुछ तो सीखा है अपनी हेल्थ को, हैप्पीनेस को, ऑसमनेस को अपनी लाइफ में बरकरार रखने के लिए। तो जल्दी से लाइक, शेयर एंड सब्सक्राइब, एंड थैंक यू सो मच फॉर वॉचिंग।